Hey guys, I just wanted to do a quick video regarding GLP medications and what we've been seeing clinically at Revitalize. If you are on one of these medications like Ozempic or Mounjaro, or you're thinking about starting one, these are some considerations to be aware of when you're choosing your provider and how to approach taking these weight loss medications. So, the first thing to be aware of is that as we've been using these meds for a couple of years now, we're starting to see muscle loss. So, there was a study done in 2024 that showed that of the total weight lost on GLPs, somewhere between 20 to 40% of it can actually be lean mass loss or muscle loss. And this is a really big deal because how much muscle you have is a predictor of your longevity, and it also closely correlates with your metabolism. And so, if a lot of the weight that you lose on a GLP ends up being lean muscle mass, then actually you can be more metabolically compromised at the end of your weight loss treatment than you were at the beginning. So, this is something that needs to be measured and protected aggressively and proactively. There's also research showing that women who lose muscle as we age or with GLPs called sarcopenia, um, it correlates very strongly with their long term function and their bone density. So, again, this is not something that is purely cosmetic. This is a health and a longevity issue. So, my best advice to people who are currently taking this medication or who are considering starting one is get a baseline ASAP. So if you're thinking about starting one, get a baseline so that you know what your numbers are and work with a provider who knows how to leverage several different tools, not just GLPs, to help you achieve your body composition goals um, without, ideally, without side effects and definitely without losing lean muscle mass or bone density. So this is something that we've been doing for several years at Revitalize. And we have a lot of patient success stories and we back this data up using DEXA scan and labs, showing that they are not losing muscle mass and they're dropping body fat, specifically visceral fat, which is the dangerous kind of fat that lives inside of the abdomen around the organs, which is high risk for cardiovascular disease and diabetes and cancer and those types of chronic diseases. So, my best advice is get a baseline DEXA, or if you've already started a GLP medication, get a DEXA as soon as you can and start understanding and monitoring your own numbers and look at how much muscle you have, body fat, visceral fat, bone density. And um, with the right regimen, you can actually use a GLP in combination with what we found to be the best combination is a GLP at the lowest effective dose without side effects, combined with hormone optimization to preserve muscle mass and bone density, and also help the patient mitigate a lot of the more common side effects that people have when they're taking GLPs alone. And those tend to be things like fatigue or hair loss or these types of like quality of life complaints that make it difficult for a patient to go to the gym and get their resistance training in and eat enough protein and stay hydrated. All of these things need to be done in combination. I highly recommend against simply going to a medical weight loss clinic, getting a prescription for a GLP-1 and taking it without monitoring your hormones and without monitoring your body composition and making sure you're getting enough protein and mitigating your side effects, because a lot of patients that we're starting to see from other clinics have already experienced muscle loss. They quit taking their GLPs because they had too many side effects, or they quit because their progress plateaued. That's another really common scenario is they lost the initial 20 pounds and then they needed to lose 20 more, and they keep raising and raising and raising the dose and not getting a response. So you need hormonal support in order to avoid plateau. And then you also need it to prevent rebound weight gain. So when you stop taking the GLP, if you've lost a lot of muscle and you've compromised your metabolism, then a lot of people will experience rebound weight gain because they have not addressed the root cause of the body composition change in the first place, which is usually insulin resistance and hormone imbalance. So I hope this helps. Thanks, everyone.